In this presentation, we're going to talk about the anatomy of the heart. Starting out here with the size and shape, the heart's about the size of a fist, with the typical weight for females being about 9 to 11 ounces, and for males about 11 to 12 ounces. The heart can be larger in cases of hypertrophy from the cardiac conditioning that comes from exercise, or from hypertrophic cardiomyopathy, which is an abnormal enlargement of the heart. The shape of the heart is broader at the top, which is called the base, and narrower at the bottom, where it tapers into the apex. And the location of the heart is within the thoracic cavity inside of the mediastinum. You can see the mediastinum outlined here with the white dotted line. It's between the lungs and then in front of the spine and behind the sternum. And the top border is the thoracic inlet. The bottom border is the diaphragm. And you can see a lateral view of the mediastinum here. Within the mediastinum, the heart is also inside of the pericardial sac or pericardium, which you can see here. This is a protective membrane that surrounds and separates the heart from other structures in the mediastinum. And it has two sublayers, the outer fibrous pericardium and the inner serous pericardium. Diving deeper into these, the outer fibrous pericardium is made up of tough connective tissue and it protects and maintains the position of the heart. The inner serous pericardium is two continuous layers, the parietal pericardium, which is fused to the fibrous pericardium, and the visceral pericardium, which is also known as the epicardium, and it's fused to the heart. It's actually the most outer layer of the heart wall. I like this image because you can see how these two layers are continuous with one another, and then the space between them called the pericardial cavity. And this space is filled with pericardial fluid, which serves as a protective cushion that helps reduce friction on the heart. Now that we've discussed where the heart is located, let's talk about the layers of the heart. So looking at the layers of the heart wall, of course, the outermost layer we already discussed, that's called the epicardium or the visceral pericardium. And it's, of course, part of that serous pericardium that we talked about. And then deep to that, we have the myocardium, which is about 90% of the heart wall thickness. And there's so much to know about this, so we'll go about it in more detail in the next slide. And then the innermost layer is called the endocardium. It's this thin layer here that lines the internal structures, including the heart's chambers and valves. And it's made up of simple squamous epithelium or endothelium with areolar tissue underneath. And it serves as a protective barrier, helps with structural integrity of the heart, and reduces internal friction inside the heart for proper blood flow. As promised, let's talk more about the myocardium. So you can see the muscular structure here. It's made up mostly of cardiac muscle tissue and contains cardiac myocytes, also called cardiomyocytes, which are the contractile cardiac cells. And it also has blood vessels and nerve fibers, which organize the heart's electrical activity and contractions. And the contractions of this myocardium are actually what pump blood through the heart. And you can see this swirling muscle pattern, which helps move blood more effectively. You can think of the analogy of squeezing a towel, twisting it to get more fluid out. Now let's talk about the internal structures of the heart. Maybe the most important, we have the four chambers of the heart, the left and right atria, which are the small upper chambers near the base of the heart, remembering that top of the heart is called the base. And these have thinner walls than the ventricles beneath them, and they send blood down into the ventricles. And of course, we have the left and right ventricles, which are the larger lower chambers. They have those thicker walls, and these send blood to the lungs and out to the body. So let's dive deeper into it. The right side of the heart handles oxygen poor blood, transporting it from the body to the lungs, starting at the right atrium, which receives oxygen poor blood from the body and sends it to the right ventricle, which then receives it and sends it outward to the lungs. And then the left side of the heart handles oxygen-rich blood, taking it from the lungs to the other parts of the body, starting at the left atrium, which receives oxygen-rich blood from the lungs and sends it into the left ventricle, which then receives it and sends it out to the body. And the myocardium of the left ventricle is actually thicker than the right ventricle because it works so hard to pump that blood all throughout the body. So you can see a picture of that right here. Now let's talk about the septa. These are the walls that divide the heart's chambers, and they're extensions of myocardium lined with endocardium. We have the inner atrial septa, which lies between the two atria, as you can see here. And the fetal heart actually has an opening in the inner atrial septum that helps with circulation. It's called the foramen ovale. And shortly after birth, this opening closes and turns into the fossa ovalis. Next, we have the interventricular septum, which is between the two ventricles, and you can see that here. And then the atrioventricular septa, which are between the atria and ventricles, and it's where the heart valves are located. So let's talk more about those heart valves. You can see the chambers here, and these are the valves. We have the AV valves between the chambers, and then the semilunar valves. The valves help to make sure that the blood travels in one direction all throughout the heart. So let's get into more detail. We have the AV valves, AV meaning atrioventricular, between the atria and ventricles. We have the right AV valve, which is called the tricuspid valve. That's the one that separates the right atrium and right ventricle. And you can think of it as tricuspid, having 3 leaflets, which you can see there. And then the left AV valve, which is also called the mitral valve or the bicuspid valve, and it's between the left atrium and left ventricle. And you can remember bicuspid has 2 leaflets. And just a note about leaflets, they're made of endocardium and connective tissue, and they're connected by the chordae tendineae to the papillary muscles, which we'll talk about in the next slide. Let's talk about how the AV valves function. You can see the papillary muscles here and the chordae tendineae here. So the papillary muscles relax, which takes tension off of the chordae tendineae, allowing the valve to open. Conversely, as the papillary muscles contract, tension is put onto those chordae tendineae and the valve closes. And this image is just a closer view of the chordae tendineae. The valve is open during ventricular diastole and then closed during systole. Let's talk about the semilunar valves. These allow blood flow from the ventricles out to either the body or the lungs, and they have 3 cusps of endocardium with connective tissue. They're open during ventricular systole and closed during diastole. So there's 2 of them. We have the pulmonary semilunar valve, which allows blood flow from the right ventricle to the pulmonary trunk out through the pulmonary arteries. And then the aortic semilunar valve, which allows blood flow from the left ventricle to the aorta. Let's see how these valves function. So there's a buildup of ventricular pressure that causes the semilunar valves to open during contraction, also known as systole. And then during diastole, the ventricles relax, their pressure drops, and the blood starts to flow back towards the semilunar valves, which then allows these cusps, which you can see here, to fill up with blood, and that filling action forces them to close. You can kind of see how that would happen by looking at this structure. Let's talk about the fibrous skeleton of the heart. So if you were to dissect the myocardium away, you could see it. It's the framework of dense irregular connective tissue that lines the internal heart, and it helps divide the atria and ventricles, manage blood flow, provide functional and structural support, and then insulate the electrical activity between the atria and ventricles, which in turn regulates the cardiac cycle. All right, getting into the surface features of the heart, we have the auricles, which you can see here. These are leaf-like structures near the surface of the atria. They have thin walls that expand as the atria fills with blood, and they help to increase atrial volume, relieve pressure on the atria, and assist the atria with blood flow to the ventricles. Next, we have the sulci, which you can see here. They're the grooves on the superior surface of the heart filled with fat, and they house the coronary blood vessels, which are all pictured in red and blue here. There's three main sulci, the coronary sulcus, which you can see outlined here. The coronary sulcus contains the coronary sinus, which we'll talk about more later, and that coronary sinus returns deoxygenated blood to the right atrium from the myocardium. But we'll get more into that when we talk about the coronary circuit. Next, we have the anterior interventricular sulcus, which you can see here, and the posterior interventricular sulcus, which you can see here. Now let's talk about blood supply to and from the heart. We have our great vessels that transport 99% of our blood, veins typically bringing blood back to the heart, and arteries typically taking blood away from the heart. We first have the inferior vena cava, which you can see pictured down here. It's a vein that brings oxygen poor blood from the lower body and brings it into the right atrium. And then the superior vena cava, which is a vein that brings back oxygen poor blood from the upper body to the right atrium. Next, we have the pulmonary trunk and arteries. These are arteries that send oxygen poor blood from the right ventricle out to the lungs. So you can see that process with these arrows here. And we have our pulmonary veins, which are pictured here. These are veins that bring oxygen-rich blood from the lungs back into the heart, into the left atrium. Next, we have the aorta, so that blood travels down into the left ventricle and then up through that aorta, which is an artery that sends oxygen-rich blood from the left ventricle out to the body. We're going to talk about it more in detail so you can understand all these parts of it. There's three branches on this aortic arch that you can see here. The first is the brachiocephalic artery, which supplies the right arm with oxygen-rich blood. Next, we have the common carotid artery, which sends oxygen-rich blood to the neck and head. And lastly, the left subclavian artery, which supplies the left arm with oxygen-rich blood. And then descending aorta, you can see that down here. It supplies the lower body with oxygen-rich blood. Now let's talk about the coronary circuit. So we've been talking about the systemic and pulmonary circuits primarily with that blood flow through the heart, but we also have the coronary circuit, which is how the myocardium gets supplied with oxygen and nutrients. It's a set of vessels that supply oxygen-rich blood to the myocardium and then remove oxygen-poor blood from it. And it helps by bringing oxygen and nutrients to the cardiomyocytes in the myocardium and then also remove any waste. The largest vessels in the coronary circuit are the coronary arteries and the coronary sinus. The left and right coronary arteries are visible here, and these supply oxygen-rich blood, so they're depicted in red on this image. They start at the aorta, kind of branching off from there and eventually branch into additional arteries. Some of those include the circumflex, which you can see here, the anterior and posterior ventricular arteries, which you can see here and here, and the marginal arteries, which you can see the right marginal artery here. Getting into the coronary sinus first, the coronary veins, they remove deoxygenated blood from the myocardium, so those are depicted in blue. And you can see those here and here. And these veins drain into the coronary sinus, which you can see up here. Eventually, the blood that drains into the coronary sinus goes back into the right atrium. All right, so now that we've talked about all these different parts of the blood flow at different parts of the video, let's put it all together all at once. So on the left here, you can see the systemic and pulmonary circuits. In the middle, you can see the internal structures of the heart. And on the right, you can see the external structures of the heart, including those parts of the coronary circuit. So starting at the inferior and superior vena cava, oxygen-poor blood travels from the body into the right atrium through these veins. And then from the right atrium, boom, boom, it travels through the tricuspid valve into the right ventricle. And then from there, it travels up through the pulmonary valve into the pulmonary trunk, out through the pulmonary arteries, and then it gets sent to the lungs. Oxygen-rich blood from the lungs is sent to the left atrium, where it arrives through the pulmonary veins and then travels through the mitral valve into the left ventricle and then up through the aortic valve into the aorta. And through the aortic branches, it travels all throughout the body. And then, of course, we just went over the coronary circuit, but you can see those coronary arteries depicted in red, supplying the myocardium with oxygen-rich blood, and those coronary veins depicted in blue, removing oxygen-poor blood to take it to the coronary sinus, where eventually it will drain into the right atrium. Lastly, here we're going to talk about an ailment of the heart. You'll recognize this one from our application assignment. We're going to talk about the leaky mitral valve. This is when the mitral valve doesn't close properly, and then blood regurgitates backwards from the left ventricle to the left atrium, causing all sorts of havoc. So this increases the volume and pressure in the left atrium, and this puts pressure and congestion on the pulmonary circuit. Not as much blood is moving forward out to the organs. And then the left atrium starts to dilate. The walls of it start to stretch. The left ventricle is working so hard that it starts to thicken. Left ventricular hypertrophy occurs. And then long term, these effects also impact the right atrium and right ventricle. And symptoms include shortness of breath, fatigue, and then atrial fibrillation could occur because of that stretched or dilated left atrium and eventually dilated right atrium, chest discomfort, dizziness or syncope, which is fainting, and increased heart rate as the heart works harder to try to get oxygenated blood to your body's organs. And there's risks of stroke and heart failure. I hope this presentation helped you to understand and appreciate your heart better, maybe be inspired to take care of it even more than you already do. Thank you guys so much for watching. Here's also my works cited if you wanted to learn anything more about the heart. You can check out some of these. Thank you.